Yeah, this was very important because the outcomes of different ethnicities and races we can talk about Black population, Hispanics, even Asians, are different, not only in lung cancer, but in many other cancers. And one of the reasons now that we are doing a lot of molecular oncology is the testing. You know? So in other words, you're not going to find the patients if we're doing the proper testing. So regarding disparities, there is a lot of problems with testing for everybody, but it gets worse with the minority populations. No? And in the United States, we have like more than 40% of the population that are minority between Blacks, Hispanics, and Asians. That is why it's a very important group of people with lung cancer that we have to worry about. That is why molecular testing is an issue, no? And we know that since in ASCO 2021, for example, there was a very important presentation about molecular testing, how only we are doing half of the molecular testing that we're supposed to do in the United States, and it's even worse for Blacks or Hispanics. Here, I live in Florida, in Miami, and we cover a lot of Latin America with the ISLC, the International Association of Study of Lung Cancer. And we have a lot of publications about genetics, for example, in lung cancer in minorities, in Hispanics. And for example, the Hispanics have an advantage. You know, they have a very high rate of the EFR gene that give them a very good chance to respond to a pill, or osimertinib. But that benefit, that can be 40% of Hispanics in some countries like Peru, it gets erased because if you don't do the testing, you never find the patients, and everybody else having chemo, and the outcome and the survival is short. You know, we know that very well because we're doing chemo now for 40 years. So that's why we talk in the Congress of Liquid Biopsies, and basically liquid biopsy gives the alternative to do a much faster testing, and it has the advantage that we don't have to worry about the tissue. And sometimes there is not enough tissue, and that's why liquid biopsies can be one of the many solutions that we can use to address disparities in the United States or all over the world. No? We talk basically about that was the presentation.